everybody, welcome back. I'm so excited to be bringing you guys this episode and these people from our ocular melanoma community, our OMIs. These are some of the OMIs that I was able to make contact with who are the furthest into their ocular melanoma journeys that I could find so far. So just leading right out, I really want to just talk to you guys about this message that these people here bring us as a community and hopefully can bring you as a patient or a caregiver to someone with OM, and just we're going to lead with some hope. So Phil, do you want to just go ahead and take your microphone off mute and tell us how far out are you right now?
I was diagnosed in 2016, so that would make it 8 years.
Oh my goodness. Okay, that's amazing. Okay, Caitlin, can I have you go next? Or sorry, Cassidy.
Hi, I am 10 years out. I was diagnosed in 2014.
Excellent. Linnell, you're next.
Hi, I'm 22 plus years out. I was diagnosed in 2002.
Wow, that's incredible. Valeria, what about you?
Hi, so I was diagnosed in 1994 and I just celebrated my 30 years out.
Oh my gosh. My mind is blown, but I'm so grateful. You guys, isn't this incredible? Let's just take a minute. Those of you guys listening, let's just take a minute to soak this in. We have someone who's 30 years out, someone who's over 20 years out, over 10, and nearly 10 years out. Then we have me, but guys, I'm a baby. I'm only 4 years into this. I'm just a little baby compared to where you guys are at. You guys, this brings so much hope, right? That despite all of the obstacles that we face as patients, despite all of the statistics and the scary stuff that we learn about, especially in the first few years of our diagnosis, are people out there who are okay. And so I really want to convey that to you guys, those of you listening. So now we're just going to kind of talk really briefly about your diagnosis. So I just want to know, obviously you said when you were diagnosed, roughly 8 years ago. So you're welcome to fill in the month, the day, whatever. Tell us which eye, tell us the location you were treated, and potentially your treating doctor if you to share. And then we'll go from there. I'm going to start back at the beginning. So I'll let you go first.
Okay, well, yes, it was April of 2016 that I just noticed a pain in my right eye. So I'm fortunate that I live in Philadelphia. So I actually went to Will's Eye emergency room on a Saturday, and by that Thursday, they had the radioactive plaque in my eye.
That's really fast.
Yeah, it was very fast. It was a very, very fast whirlwind experience. Yeah.
Yeah, for sure. Okay, Cassidy, can you go next?
Yes, so I was diagnosed in June of 2014. I actually was just going for a regular eye exam where I was told, oh, you have a freckle and you should follow up with it. And thank God I did, because it ended up not just being a freckle. I was treated by Dr. Finger in New York City, where I was living at the time. And I think one of my biggest challenges was I was only 25 when I was diagnosed, which is fairly young. So there was a question about having children and can I bear my own children if I had to get Avastin, now Eylea, whatever injections. And thankfully I have two children, one 10 weeks old. So that was a really positive thing that came from this, was I was able to do all of the things that I normally would do.
Yeah, just that you get a lot of questions about is this even going to be possible for me? And congratulations on your most recent baby. That's amazing. We're going to go back to all of you guys because I have some other questions, but I want to get to Linnell and Valeria. So Linnell, do you want to go next?
Sure. Like I said, I was diagnosed in 2002. I've had 3 opinions that led to the actual diagnosis by Dr. Robertson at the Mayo Clinic here in Rochester, Minnesota. He was instrumental in the CALM study. I don't know if anybody is still familiar with that, but he is the primary author, and I was really fortunate. I didn't go into a study, but the results of his study found that we could literally keep an eye on it. And so for me, that just meant very regular monitoring. And my tumor, which is in my left eye and not too terribly close to the optic nerve, which I'm thankful for because I still retain full sight. But we were able to keep an eye on it, so to speak, for a lot of years. And then Dr. Robertson retired. I then started seeing Dr. Polito at the Mayo Clinic, and he had different techniques and he detected growth. Maybe he was more conservative. Maybe his techniques were a little bit more modern than Dr. Robertson's. Nonetheless, he detected growth. And so we did decide to do the plaque treatment in 2012, January. So I've been treated, it'll be 12 years this year that I actually got the treatment. And as far as we can tell, it's a dead tumor. So yay.
All good things.
Yes.
Okay, well, Valerie, I've kind of that we're going in order of who's kind of freshest in the lineup up to who's been here the longest. So Valeria, what about you?
So Cassidy, I was 25 years old and I was diagnosed because I realized that I couldn't see anything from one day to the other. And I went to the doctor and they sent me to another doctor. It took a lot of time. I was living in France and I ended up coming to Boston to get treated at Mass Eye and Ear by Dr. Gragudas. It was in my left eye too.
Goodness, 25 years old, both of you. That's insane. I mean, I was 28 when I was diagnosed and it still felt insane. So I guess that doesn't really matter too much. I think that it probably doesn't matter what age you are. It all feels pretty insane when we get this diagnosis. So this isn't on our list of questions. So I apologize for putting you guys on the spot, but I'm curious, which of your doctors told you that you were really, really rare, like your diagnosis was really, really rare? And I'm just curious what you found out at the time that you were diagnosed about finding anyone else who was like you. Phil, were you told that there were very many people with ocular melanoma that you could ever come in contact with?
All I was really told was just that it was rare. I mean, it all kind of happened right, at Will's Eye when I was, speaking with Shields and Shields, and that's first time I found out what it even was. Yeah, I mean, they had mentioned it was rare, and then on top of that too, it was so fresh for me. I had no clue what was going on that I actually went on to Google as I went back into the waiting room to go on to my next round of tests that they were doing for me. So yes, it's spectacular how rare it is.
Yeah. What about you? I just have run into some patients, just for background. I've run into a couple of patients who were diagnosed over 20 years ago, and their doctors told them they would never meet another person who had this diagnosis them. And I'm just curious if any of you guys got that feedback.
I did. So I was told 6 in 1 million people, and the average age of diagnosis is around 65 years old. So I was a rarer case than already rare. But funny enough, I know about 5 people, some personally and some just 6 degrees of separation, that have this diagnosis. So I find that 6 in 1 million, maybe it's more common than what it's said to be. Or I just really randomly.
Or maybe there's more people.
Right. Maybe, yeah. So, yeah. So I did find it pretty wild to know so many people who have this diagnosis as well.
Yeah. Well, Nell, what about you?
Yes, Cassidy, I was told about 1 in 6 million, and I was really rare because I come from Hispanic heritage, and it's even more rare in my ethnicity is what I was told. And back then, we didn't have social media like we do now, so we had a clunky listserv. We did have the internet, so I was able to find a group of people. There was maybe at any given time 20, 30, maybe 40 people on this listserv, and it was nice to be able to talk to them. They were all different ages and very different backgrounds, but yeah, I still felt alone, and I knew nobody that had this. And I know of a few people since then in my inner circle, but yeah, I still feel I'm very rare.
Yeah, no, for sure. Valeria, what about you?
So in 1994, there was no Google, there were no social media, nothing. And maybe that was a little advantage because, you don't read everything, you don't freak out. And I was young, so I thought, okay, I'll do what I have to do and it will be over. I didn't know anybody. 10 years later, because I haven't said everything. So I was diagnosed 30 years ago, but 20 years ago, I got my first metastasis. And so 20 years ago, when I had the diagnosis of the first metastasis, I also tried to find people, and there was this Ocumel email list. And it was very good to see people who are on the same journey as you are. It's helpful.
Yeah, for sure. And I just want to point that out, you guys listening, Valeria is 20 years out from metastatic disease. So 30 years out from eye diagnosis and 20 years out from metastatic diagnosis.
Yeah.
Isn't that insane? Valeria, I want to be you when I grow up. I'm 2 years out from metastatic diagnosis. Yes. No, and I think that's one of the things that one of my doctors told me was, you guys be your own statistic. I feel like I'm dropping that ball a little early. Maybe we should have left that to the end. But isn't that the truth? Like that we all really have to be our own statistic and just kind of say, screw it to the numbers and to the scary things, because at the end of the day, you are your own person. We're each, we have unique biology, unique fingerprints, unique eyeballs. There's every single thing about each of you as an individual is so unique. And as much as we try to understand, and a lot of research has happened in the last 30 years, just for spanning for everybody who's here, a lot of progress has been made. A lot of things have been better understood. That doesn't mean they know everything. That doesn't mean that they have all the answers, or that just because the path looks a certain way, that it means it ends a certain way. So I love that. And I love that we can illustrate that. So I'm curious, I'm actually going to go backwards this time. Valeria, do you still have any kind of scans or blood work at this point?
Yes, I do, because every once in a while I have new metastases. I'm supposed to go once per year back to the ophthalmologist, the eye doctor, to have my eye dilated. I don't go every year in the last years. I have a very good optometrist here. I live in California. And I go to her and she's very meticulous. And if she sees something, she will send me. But otherwise, yes, I do scans because I have had various metastases over the years. So we keep an eye on everything.
Yeah, well, that makes sense. Okay, Linnell, what about you? Do you still have some sort of surveillance scans?
So I'm the bad one. I was very religious about my scans per the doctors over the years. And the last scan, full body scan and thorough exam and photographs and ultrasounds that I've had was in 2019. In 2020, the world was in uproar and I couldn't make it to my appointment. So it was put on hold for 6 months or more. And then it just never happened for me. Since then, I've kind of decided that, I'm not going to forego scans altogether, but I think for me, I do not have, that's not to say it isn't going to happen. I never take that for granted ever. But I feel that for me, the benefit of not having the yearly dyes put into my kidneys, for me, just outweighs the risk. And maybe I'm wrong because I'm making up my own statistic, but that's my decision right now. I do keep bothering myself that I do need to make my appointment at Mayo Clinic. I have a third doctor now. I've been in this so long that they keep retiring. So, and I have only seen her once, and I met her the first time in 2019. So I do get the photographs and the ultrasounds, but I'm not real good about yearly. I do get my regular eye exams because I go in for eyeglasses now that I'm old, but all they see is the spot. They're not there to do anything other than give me prescription glasses. So I'll do better.
Okay. Hey, I think we all do the best that we can in the phase of life and the season of life that we're in, and I think that that's okay.
I was just going to say, for me, has reached a point where it is no longer front and center in my life, and so that's another one of the reasons that the scans have kind of taken a back seat for me now. And with any kind of longevity, I think that maybe it won't take front and center anymore. It certainly did for a good part of my life.
Yeah, agreed. I think that's probably a really good thing to focus on. Cassidy, what about you?
So I aspire to be Linnell, but I'm not there yet. I did get scans of my liver every 6 months, MRIs, and now I've graduated because I'm 10 years out, to my oncologist really saying, you don't need anything. And I said, can I have it? Because I do still feel, if I can, and I'm very privileged that I have good insurance and that I can get these scans. For me, as a young person, why not? Because I do feel I would want to catch any metastasis early. So, I feel more comfortable. So we settled on ultrasounds because those are, no radioactivity, things like that, safer. So I'll be doing ultrasounds yearly.
Okay. No, that makes sense. Phil, I'm going to assume you're probably still kind of in the middle of some sort of surveillance, I would hope.
Yeah, well, to be honest, I have not seen the eye doctor in a couple of years. It happened that there was a scheduling problem and I just never rebooked it. However, I do have metastatic disease since 2017, so I do get scans every 3 months, and then sometimes they'll throw in a PET scan, but typically it's just an MRI and a CT. So yeah.
Okay, so since 2017, you've been navigating metastatic disease. So what is that, 7 years almost?
7 years, yes.
My goodness, so you're 8 years into diagnosis, so that was right after.
Yes, it was.
Oh man. Okay. Well, I feel this is a good time for us to talk a little about some of the emotions that came up because that's hard. That's probably one of the hardest things that I have seen. Some of the friends that I've made over the social media connections and just through having guests on the podcast is hearing from someone who gets diagnosed and then a year or less later finds out they have metastatic disease. And it's really, it takes all of the terror and the fear and multiplies it by a lot. So, Phil, do you want to just give us an idea of just what are a couple of emotions that you've felt over the course of maybe the last 5, 7, I guess we could say 7 years?
Yeah, definitely a fear. It was just the fear of the unknown. What the future looked. I did have a really hard time kind of looking at my life past 3 months, past my next scan, and it was a long time that that I felt that way. But I'm no longer there now. I feel more confident and more not as concerned anymore. I don't know how to properly word it, but it's just not something that is front and center anymore. I'm just, living my life and doing the best I can, and there's really nothing else I can do about it. So
yeah,
that's the biggest one. It's just fear, and then anxiety goes along with it. So
yeah,
those are the big ones.
No, I think that's such a good point though, that it's almost, I don't want to say your emotions become your friends, but they do become kind of your constant companions. And So some of these common emotions, right? The fear, the anxiety, maybe, I mean, I have felt some depression myself. I think that they just kind of become something we're just used to, maybe in some ways. I don't know if you guys feel that way. Cassidy, what about you? What are some of the emotions you felt? Because I know you were diagnosed really, really young.
Yeah. So I think to echo Phil's sentiment, what first came to mind was fear of the unknown. You don't know what the next 6 months are going to look, what the next year is going to look. But I too feel it's not front and center in my life anymore. I would say when the scans come up, I get a little bit anxious, and then that goes away once everything is okay. And I'm not living with metastatic disease. But one of the things that I do feel, even within our community, is this weird sense of this survivor's guilt kind of thing, where I don't have metastatic disease. So then you start comparing yourself to other people with the diagnosis. Well, I'm not that bad, or I'm not, and then where do you fit in this scheme of this diagnosis? And then you don't want to feel, I shouldn't be sad about this because I don't have metastatic disease. So I do feel sometimes I get confused in my own emotions or how I should process. And of course, we're all going through our own journey, you said, so it's okay to feel those things. But sometimes I find myself saying, maybe you shouldn't feel that way because you're doing okay, which I'm very grateful for.
Yeah. Now, I hate to break it to you, even if you're living with metastatic disease, you still feel some sort of survivor's guilt. It doesn't matter where. I honestly don't think it matters where you are in metastatic disease, whether you're dealing with something actively or you've been stable for a while. I think that those feelings can come up all the time because the kind of harsh reality of it is there really is somebody out there who's always a little bit worse off in some way from you in this current moment. And that's hard to grapple with. It's complicated, I think is maybe a good word for it.
Agree. Yeah.
Linnell, what about you?
Oh gosh, yes. I can resonate with everything that's been said. I don't have metastatic disease either, but the emotions just at the onset of diagnosis was I was numb. I couldn't function. I couldn't go to work. And there were 5 days between my initial diagnosis and the second opinion, which led me to the Mayo Clinic. And those 5 days I remember very succinctly. I don't think it'll ever grow dim in my mind. And I reached out to the Ocumel list and talked to anybody and everybody who would talk to me, and they really got me through. There's a lot of fear, throughout the years it has ebbed over time, but I will say this anxiety never goes away. It hasn't for me. All these years out, it has not, and I can't imagine that it ever will. So it's very real. These emotions, you learn to live with them, make friends with them, however that is, but they're still so very real and so very poignant, and it definitely helps to have good support.
Yeah, poignant is a really good word for it. Valeria, how about you?
Well, I do remember, but not as vividly, the first time when I was diagnosed with ocular melanoma. And it was brutal. But for me, when I was first diagnosed with metastasis, that was very scary. And of course, every time I had metastasis, it was very scary again. But the first time, it was horrible. And people would tell me, oh, what are you doing for the holidays, for the vacation? I can't think a month out. I cannot think 2 months out. I don't know what will be, right? Where I will be. But I have terrible survivor's guilt. Terrible. I think, yes, anxiety, yes, stress. You get used to it, though. I'm not saying it's getting better, but every time you have scans, it's the same fear. I don't know.
It's kind of a similar pattern. I think, maybe that's really the only thing that really happens is it's not that it's a good thing, that it's somehow changed from being this hard, bad thing or this hard, difficult thing into a better thing. It's not changing in that way. It's more tolerable because you've gone through it so many times. Almost you're desensitized, I think, in some ways. And I can only imagine too, for you, Valeria, you've gone through this for over 20 years of metastatic disease. And I mean, it's been a long 2 years for me. I can only imagine what 20 years feels of going through this cycle and periods of stability and then another set of bad news or another set of, oh, you have another spot or another thing that we need to address. And I guess the only thing I can think of is that it's almost you have to kind of numb yourself to it in some ways just to be able to confront it.
It depends. Maybe some people need to be numb. I need to be on top. I become alpha. I have to know everything. I have to face everything. When I have a new diagnosis, I become a monster. I read everything. I put everything, all my choices, the options down. I don't let any little detail go missed.
I'm that. And I guess numb is maybe the wrong word for it, but it's almost you don't sit in the fear and the the catastrophic space very long because you said you don't really have time to. And it feels a lot better. It feels a little more empowering to me, at least, to focus on the things I have control over. And a lot of that is the intake of information, for me at least, is that intake of how much can I learn about what's available to me today. That can be really helpful. Just by show of hands, have you guys found it helpful to find out more about your diagnosis and just about the current status? Yes or yes, give me a thumbs up or a hands up, and no, just don't raise your hand. It's okay if you're a no. Phil's over here, no way. So I think that that's a good thing to illustrate, though, for you guys listening. Some of us are people who find that this is really, really helpful to do, right? To really immerse yourself in a not only community, but also in the information, in the research. And there's a psychiatrist that we had come and speak at I believe she was in Seattle. So if you go back to the I Believe 2022 YouTube channel playlist, you'll be able to find some of the things that she talks about, how people are different, we're wired differently to cope with these things. And so that would be a really good episode to reference for just kind of understanding the psychology behind it, or if you can find out other strategies if you're not that person. So I'm going to give Phil a chance to tell us maybe what he does instead of finding out all the information, because I think that it's a really valid place to just distance yourself from it. So Phil, I'll let you go next.
Yeah, sure. I mean, the reason I answer that way is because I have a very supportive wife who just kind of, since day one, she's been the one there for me that's been, helping me navigate all of these things. And sometimes when things just get too tough for me, I just, I allow her to, just kind of take over and help me with the decisions I need to make. But if I did not have, my wife, I don't know if I would still be the same, as far as wanting to know these things. But it just, sometimes it just feels a little heavy. And, if I just listened to the first piece of information I got when I got diagnosed, I'd be a very big wreck. I would, because it didn't turn out to be that. So it's, for me, not knowing was kind of my way to, what happens is going to happen, and I've made peace with that.
Yeah. Well, and I think you're illustrating acceptance. And I think that a huge part of resilience, which is just, for me, that's the act of getting back up every single time life tries to knock you down. A huge part of resilience is acceptance. And so I'm just hearing different ways that we all work to accept, right? That we've worked to accept our diagnosis and to just kind of live with its constant presence in some capacity. Cassidy, I think you're the only one who hasn't had a chance to respond.
Yeah, no, I think I do think when you Google this diagnosis, there can be a lot of scary things that come up, scarier than I think most of our realities actually. So it can be very, very frightening. And, especially for me with young children, that kind of hangs over my head a lot. And was even a question of, do I want to have kids if I don't know how long my life is going to be? And thankfully, I've had long conversations with my oncologist who, is very well versed in the research and kind of can give me the cliff notes a little bit too. And I've done a lot of research myself. I think beyond that initial Google search, there's so many studies now. There's so much more information now, even than there was 10 years ago. And I do think that the social media part is actually super helpful for me because I get to see people who are living very fruitful lives way beyond the 10-year mark that I wasn't even sure I was going to make. So I do going on social media, even if I'm not super participatory in the Facebook group and all the other chats and stuff, I have to read about other people's journeys because it gives me a lot of hope.
Well, thank you. I love hearing from you guys. This has been so neat. I do want to ask, you guys have all of you have referenced some kind of support network, whether it's your spouse or just the people around you, your doctors' offices, Facebook, all of those different things. But I do want to just highlight a couple of things. Have you guys sought out, and again, there's no right or wrong answer here, and I'll just go first. I have therapy almost every week. It just helps me stay sane. But I have therapy every single week, or, as often as I can have it, to help with kind of the mental load of this diagnosis, because sometimes it is a lot, and Phil said it gets heavy. So therapy has been something that I've sought out. I found it helpful to connect in person when I can with other people. Maybe not all the time, but, whenever I have the opportunity to connect with people locally, I've done that. Have any of you guys else found, anything outside of social media support helpful? And obviously your doctors, anything you've already said, is there anything else additionally you feel has been helpful to support you in your diagnosis? Any volunteers to go first? Phil?
Yeah, sure. I mean, honestly, something that's really helped me is just, medication helping with anxiety and depression. I mean, and I've actually kind of come to a point where, I've had the metastatic disease for so long, and I've kind of reached a point in my life where I feel, while it's still there, the depression and anxiety, do I really need to be, doing what I'm doing as far as medication goes? And can I scale that back? And can I, have a life where, I don't necessarily need that? Not that there's anything wrong with it, because it has been such a huge support for me to get me through the darkest times and, the scary times. And I mean, it's a really good thing for me. So I really, medication has been a huge help for me.
And so just to clarify, you're saying medication. Like I sit and I
Medication.
Okay.
Yes,
No,
yes,
you're
yes.
good.
Yes. Okay.
I just wanted to clarify. Both things are good. Let's just put that out there. Both things are good. But I think that I hope it's validating for somebody out there listening that if you do need support, right? Whether it's an antidepressant, anti-anxiety, there's so many medications out there. There's so much psychological support that we can get. And you guys, none of us could go through this diagnosis without being affected emotionally and mentally in some way. I think that we just need to put that out there. This affects all of us in some way, in a way that we need support. And how you get that support, there really should not be any stigma or frustration or shame around how we get that support. So thanks, Phil, for bringing that up, because I really think it's important. Cassidy, what about you?
I rely heavily on humor. When I got this diagnosis, my parents, I was 25. The first people I called was my parents. How am I going to call my parents and tell them this? I remember walking home from Dr. Finger's office by myself, or no, from the clinic, who said, I think this is a tumor. I think this is what this is, by myself in hysterics. How am I going to tell my parents, this diagnosis? Nobody wants to hear that their child has cancer. And then that was met with a lot of humorous things, and even going into the OR, that's my family. So being surrounded by a lot of support with my friends and family and laughter and living as normal of a life as I can. And I also remember dating at the time, and when do I bring this up? I was 25 years old looking for a potential partner. How am I going to bring this up? When does this come up? Do I wait? I ended up telling my now husband on our first date with a few drinks in me, but
Just drop it down.
Just dropped it there. Because it is a big thing to live with, and it is your caregivers are taking it on, a little bit of a burden. Your support is taking on the burden of caregiver a little bit. And so, yeah, thankfully he understood that this is just going to be a part of my life. He loved me anyways. Been together 10 years. So
it's amazing. I love that for you guys. And Linnell, what about you?
Yeah, I guess I didn't even think of therapy. That would have been so helpful. It didn't occur to me. But
Hey,
at
it
the
can still be
time,
helpful now.
I could, and I need therapy for more than one reason. But for me, Cassidy, I reached out to just anybody and everybody. I have a very close-knit family, and they were very understanding, but we were all so clueless about what is eye cancer. This is so weird. It's so crazy, and it was really hard for even me to understand, much less them. Friends, I didn't reach out so much to friends, and it sounds funny, but for me, I didn't really want to. I felt really private about it in that regard. Who I really turned to was, again, the Ocumel, the people on that listserv. They helped me so much. I will say they were my lifeline. I have talked with other people since, more recently on the Facebook page that are feeling the desperation that I felt. And I said, this group, I'm so happy you have found them. They will be a lifeline for you. They were for me. Nobody that can understand you the way that these people can. And to me, that's just life. That's life. The other thing for me, I turned to God. I did a lot of praying. And I think, I just relied on a faith that has since grown because of this. So that also helped me through. It just helped me find some measure of peace during the hours, when I was going through the scans, waiting for results, heading into surgery to get the plaque in and out, and all the things. So that has also helped me a great, great deal, tremendously.
Valeria, what about you? I know you mentioned finding information, learning information has been really helpful. So anything additionally?
So the first time when I was diagnosed with the primary cancer in the eye, I told my family, but they were so scared. For me, it was so stressful being with my mom because my mom was so stressed those days. And I understand the reason, right? Because for her, it was inconceivable that her child had cancer. But I had close friends and who helped me a lot. And when I was diagnosed with metastasis, I had just lost my mom. And again, I had my husband, I had my friends who helped me, and Ocumel. Because if it was not for Ocumel at the time, I remember when I found it and I sent the first email, because I believe that no matter what the support of your family, of your friends is going to be, it won't be the same as the support of the people who are going through the same thing. These are the ones who understand. You say, oh, I have metastases, I'm going through this and this. And they understand totally because they went through that, or they've been going through that at the same time. And I think that helps a lot. That helps a lot.
Yeah, absolutely. So I want to switch gears. I know we talked a lot about emotions. You guys have handled this so well. I feel like you guys have had some really amazing insights into just the reality of navigating this diagnosis, either in a stage of stability or in kind of the unfortunate, we're used to the unknown kind of a feel. And I, again, just want to highlight, we've got technically 4 people on here, or 3 people on here if you include me, who are navigating living with metastatic disease. And emphasis on the living, right? We're living with it. And isn't that amazing, right? Let's just, again, take a minute to just absorb that. Those of you guys listening, there are people out there who are living with metastatic disease, living their life, having vacations, spending time with their families. Are we triggered? Do we feel emotions? Do we, need support? Absolutely. But we're still doing it. And Phil and Valeria, you guys are just some excellent examples of people who are really just continuing on, just really despite all the odds. That's kind of the best way that I can think of it, is that you guys have a lot of odds stacked against you and you're still here. And if you guys follow me, I think Cassidy, maybe you've seen maybe a post or 2 from me, but I have coined the phrase or the mantra personally. I'm here today. I will be here tomorrow. I'm pretty sure. And the tomorrows add up. And I believe that 100%. And maybe I didn't think that I could believe that, initially, because when you guys have talked about when this first happens, be it your primary diagnosis or a metastatic diagnosis, all of it wrapped up together, it kind of feels a little insurmountable and it feels a little impossible. How could I ever get to a place where I feel somewhat used to this and just able to keep going on and it doesn't completely unravel? My life doesn't unravel every time something happens. And I would argue, I think Phil and Valerie, life probably still unravels a little every time something new changes in a metastatic diagnosis, but it doesn't derail us maybe quite as easily or for as long. And I think that is just a testament to your guys' resiliency, and it's incredible to see. But I do want to ask you guys, let's just chat briefly, and this might actually be mostly a question for Linnell and Valeria, but Cassidy, Phil, if you guys want to chime in, you're welcome to. I'm talking side effects. I am curious because I would venture to guess, Linnell and Valeria, you guys were diagnosed long enough ago, you probably didn't have a biopsy, so there was no prognostic information to say, oh, well, you have this good of a chance of being okay or not. And kind of a moot point with Valeria because she's also 20 years into metastatic disease management. So she's just literally her own statistic. We love it. But I'm curious if you guys have experienced vision loss. And I'm also curious, Valeria and Linnell, did you guys have a small tumor? I'm just curious if it was a very small tumor that was diagnosed or if it was larger, medium, somewhere kind of, somewhere in between. Linnell, can I ask you first?
Sorry, finding mute. Yes, you were right. There was no biopsy then. I was classified in this no, I'm sorry. I'm trying to remember. And it's hard to believe that sometimes these details really do get fuzzy, but in time they do. I was a medium to large, but more on the medium side. He was just trying not to be too conservative with that. So,
and you still have vision, correct?
I have full vision in my eye. I have practically 0 side effects, with the exception, if I really pay attention, I can see there's a little bit of spottiness to my vision, a retinopathy, and also the colors in my treated eye are not quite as vibrant. And you know what? That makes no difference to me whatsoever. I don't notice it at all. Really, I don't. Sometimes my eye might get tired after a long day on the computer.
But you have kind of a more medium-sized tumor that also hasn't resulted in vision loss.
It is funny because it was a little concerning in 2012 then when I got the plaque. They weren't sure that they could build it large enough because it was that bordering on possibly large, but right. So knock on wood, it worked and the tumor continues to shrink. So, and I retain the vision.
That's so neat. Yeah, what about you?
Yeah. So yes, I have side effects. I have lost the lashes on the lower part of the eye, and I don't see very little. I have some peripheral vision, but it's worthless.
And did you have a really small tumor or did you have a larger tumor?
I had it medium size. I don't remember. I used to remember the size, and now, of course,
it's kind of obsolete information at this point.
Exactly. And of course, no biopsy at that time, no information, nothing.
Okay, well, I think it's super interesting. I am curious, Cassidy, Phil, did you guys have small, medium, large classifications? And I would hope you had a biopsy if you were in the last 10 years, but I'm curious, Cassidy, if you had one.
Yes, I did not. So
Okay.
I had a small tumor, but it was 2 millimeters from the center of my vision, from the fovea. So unfortunately, they did have to radiate around my fovea, which they really did so delicately. They really tried, the radiation oncologist really tried to just do it enough that they could get the tumor. But I have maintained 20/25 vision in that eye over the last 10 years with some retinopathy, but I do still get injections every 5 weeks. And my oncologist recommends me do that for the rest of my life. That is controversial as far as every doctor has different, I've gone for second opinions on this, and every doctor has a
that's a
different
long
kind of treatment plan. Some say after 5 years, it kind of plateaus. I've recently moved out of New York City, so trying to find a retinal specialist down here, and they say, why are you still getting shots? You don't need shots anymore. You really have no edema there. It's looking good. So it's been hard to navigate that. What's the best course of action? But so far it's been working for me. So I'm sticking to what I've been doing because
it's probably scary to stop something that you feel is
exactly
helping.
You know, if I was at a different stage in my life, maybe I would give it up, because the biggest side effect for me is when I get the injections, the betadine is extremely painful for me, and I'm almost debilitated for 2 to 3 hours after getting an injection. But it's worth it if it's keeping my vision, and in the scheme of things, it's tolerable. So.
Yeah. I have a follow-up question for you, but I'm going to come back after we talk to Phil. So Phil, size of the tumor, side effects you deal with, vision, but I'm going to assume you've also had some treatment side effects from metastatic disease.
Yeah, so as far as the eye, it was a large tumor. I forget the exact size, but it was very big.
Large enough to be scary.
Yes. And about a year after I had the plaque, I started wearing an eye patch just because the vision, it was too difficult for me to see out of a perfect eye and then this whatever you want to call this other eye. So for me, it did help wearing the eye patch, but now I'm at a point where I don't wear the eye patch because I don't have any vision I mean, again, Valeria said, I have similar where I can see a little bit of peripheral, but it's really just maybe shapes and colors, and that's about it. But I don't miss it. I don't realize, I don't have it. It's, yeah, that's where I'm at with my eye.
And have you had any side effects from treatment with metastatic disease?
No, surprisingly, I have not had any side effects. I mean, it's been a couple years since I've actually needed treatment on the liver, but yeah, I mean, no, nothing. I mean, I feel sometimes I have pain, and I tell my doctor, and he's like, no, that's not, no. So
my doctor always says your liver doesn't actually feel pain the same way that the rest of your body does. So let that reassure you, is what he tells me.
Yeah.
It's definitely interesting. Okay, well, thank you. Cassidy, this is, I guess, really a question for you, because I think you're the only one that this really would apply to, is that you had a small enough tumor. You're now dealing with the threat of vision loss if you stop the every 5 weeks, you said, every 5-week injections that are helping to preserve your vision. And thankfully, it seems you're one of the people that's done that for. But I'm curious, if you had a time, or a chance to participate in a clinical trial that had the capacity to potentially save your vision at the time you were 25 years old and make it so that you didn't have to deal with these injections for the next 5 years. As long as the treatment worked successfully, I don't know what the percentage of it working is, but it's got a really good chance of working. Is that a trial that you think would have been worth having access to had you had that 10 years ago?
Yeah, definitely. I mean, there were big factors back then. The having children thing was that was as big as the diagnosis for me when I was told, hey, you might not be able to bear your own children. That was really devastating to me. That really affected me.
Was that because of the radiation, or was that because of the genetic risk?
They felt at the time that the injections, the Avastin, might prevent a placenta from growing appropriately, or a fetus from growing appropriately. So they said, if you're getting those injections, we're not sure that you can really carry a baby. There's so much research that's been done since then, because people get this for diabetic retinopathy. And there was a study done with over 400 women who were getting these injections while they were pregnant for diabetic retinopathy. And there were really successful results and stuff. So I went to some fertility specialists. I know, sorry, this is off topic, but they actually said that the risk was very low of an intravitreal injection with this low of a dose would cause any sort of interruption to a pregnancy, and that the bit was so much higher. But at the time, I didn't know that, so I froze my eggs. I was on the path of having to potentially use a surrogate one day. So that in itself was a whole other thing that I was dealing with that was really scary for me and was almost, in a sense, I felt my doctor reassured me I would be okay from the cancer, but I don't know, the not being able to have children or that being a thought because surrogacy is really expensive. And I didn't know, hey, am I never going to have children? That was almost more devastating. I don't know, or equally as devastating. So
Yeah.
yeah, sorry, I went off topic.
No, I,
but
I can only imagine. I mean, I have 3 little kids, and I had a 9-month-old at the time I was diagnosed, and it was still hard and scary. But and I made the decision to no longer even entertain the idea of having kids after that point, just because
yeah,
the idea of the uncertainty that my kids were already dealing with, and having another baby just felt too much to even
yeah,
entertain. But I think it's important to highlight too that just the possibility of having that chance of saving your vision while also treating the tumor and having less of the scary kind of risk things that are
yeah.
happening around pregnancy, that could be a factor for someone. So for
But
any
I
of you
would have
guys,
done it.
if you have a small enough tumor, if you're fortunate to have had a small enough tumor found, please consider just researching, asking your eye doctor, your ocular oncologist about the COMPASS trial. It could be a really good fit for you, and it could end up saving your vision long term if you end up having radiation damage that, 20 years out is happening, or it could just provide some extra reassurance in the chance of, bearing future children or just wherever your life might take you. I hope that there are enough people who find it worth that, because we really want this treatment to get approved so that it can move on to treating larger tumors and potentially even treating, it would be really neat if it could treat metastatic disease as well. But we've got to kind of start somewhere and branch up from there. So anyway, had that question for you. So thanks for asking or answering that, Cassidy. As we wrap up, you guys, I do want to wrap up and just be respectful of the rest of your guys' time. But I just really want to leave our audience and those of you guys listening, I want to leave you one piece of advice from each of these incredible patients. So we're just going to give you guys a chance to just share 1 or 2 sentences of what would you share to someone today if they're diagnosed and they're just in the fear, and what, be it their primary diagnosis or metastatic diagnosis. I think both could apply. Anyone have a dire desire to go first? Nobody wants to go first? Oh, I'm going to call on Linnell. Okay. So what would be one thing you would share with just
Well,
anybody listening today?
I would say I have been so inspired just by this panel itself in the last hour. This has been so wonderful and so uplifting for me. So, if I'm going to give one piece of advice, it's don't deal with this in a vacuum. Reach out, get whatever people that you can to support you, whether it's your doctors, your family. Sometimes it's not family, they don't understand. Friends, definitely the Facebook page, anything that you can do. I think it's just so important. I've said it earlier that the support of others is life for this particular disease, especially since we're all so rare. So that's my 2 cents. I can't stress the importance of support.
Thank you, Linnell. Anybody want to go next? Phil?
Yeah, to kind of piggyback off of that, I always to say find your tribe because, for me, I had went to a couple of the ocular melanoma get-togethers and it was great. But, as Cassidy had mentioned in the beginning, that if you look up this disease, the median age of people are 65 years old. And at the time I was 28, I didn't really connect, even though we shared the same the same disease. It's just I didn't really necessarily connect exactly with that group of people. So I actually went to a stupid cancer event, which is meant for, young adults. And I found that, while I enjoy the ocular melanoma groups because I get all my information regarding my disease, I sometimes needed to branch off and just find other people that were also there, my age, kind of dealing through, coming through some of the same things. So yeah, I would just say, find your tribe. I mean, find people that are going to, be there and you can support each other.
Awesome. Thank you so much. Cassidy, you good to go next?
Yeah, I agree with what Phil said. And I think also, what we've said this whole time is that you can have a full life and you can have some sense of normalcy back in your life. And it may take time to get there and everyone's journey is different, but know that we're sitting here today. And I think we've all said that we have some sense of normalcy back in our life. So it does come, there is hope. It does get better. You learn how to cope better. Yeah.
I love it. Thank you, Cassidy. Valeria, I think you are our final sage wisdom coming from the person who's been dealing with this the longest.
Yes, so I agree with Linnell and Phil and Cassidy. And it's important to find the people who go through the same thing. And I understand it happened to me too, to go to one of the conferences and be around people who were just diagnosed, no meds, and just the primary cancer they were just diagnosed. And I felt that I was I was part, but not really part of them. So, but that's why I really think there is power in the Facebook groups, the Ocular Uveal Melanoma group and the metastatic, because you learn a lot. And if you go through something, there are people there who can help you. And also, something that I've always said, you are the best advocate of yourself. So I understand people feel who don't want to know anything, and I understand that completely, but they have good caregivers who do their research. But it is important that someone has done the research at every step of the way. They know exactly what is going on, what are the options, go find a second opinion, everything, because ultimately you are the one fighting for yourself, right?
No, I love that. Be your own best advocate.
Yeah.
And I can't think of a better way to end than there. So you guys, thank you so much. And thank you to our listeners for just sticking this out and listening to these guys talk about their stories and talk about the things that have been helping them. We hope that it's been helpful for you. Please make sure to hit subscribe and share this with another patient or another caregiver just to give them a little extra hope. Whether we're ending the year with hope or starting the year with hope, I just think it is such a powerful thing to just recognize that we're all here. We're all here. We might feel a little crazy some days, but we are all here. These guys have been here dealing with their diagnosis, navigating it, and Cassidy said, still living their lives. And I think it's such an important thing that we get to a place where we not just survive our diagnosis, we want to thrive, right? We want to be